Nicole O'Neill once said, when you find the courage to use your voice, it has the power to positively inspire and change the lives of others. It is one of the special gifts you have to offer the world. It is something to be cherished and championed, never hidden. And that is why we are here on Your Voice, Your Impact. I am the energetic EJ. I am a life and transformational coach, and I work with women aged 40 and above to turn their abandoned dreams into achievable goals by activating their voice for impact. I'm also a podcaster and an event host. On this show with me is
Great, so amazing. The goal of this show is to help people use their voices to create impact. I am a physicist and a life coach. What I do for my clients is I help them build systems to achieve their goals whilst having fun doing it. On this show, we discuss topical issues that can inspire you to move. Like, subscribe, and share. Welcome aboard.
Hello. Good evening, everybody. So I'm super high. I am super high this evening. High on expectation. High on I'm high. So first of all, we're having an event this weekend tagged Disruptors. It's a Kingdom Entrepreneurs event live in Dubai. And I'm just super excited about it. So today we went to do a final check at the venue of the event, do some sound and technical check so that, on Saturday we are ready. And I'm just super pumped. I am so excited about, what God is doing in this season, in our hearts, and just being a part of it all is giving me so much of excitement. So with that energy, I came into the studio and my ladies are in the studio already and they're also high on energy. So guys, just get in here because this conversation tonight is going to blow your mind. All right. And I love how everything is aligning, with the topic we're having today. My co-host Grace has a story to tell in that regard. And our guest today is also all set to share her own story. And this one is particularly special to my heart because this is somebody who is going through. So it's like she's going through and she's managing, the situation, navigating it, but not doing it alone. Standing here as an advocate to create more awareness and to carry more women along to help them live a better life managing endometriosis, right? And then there is the other part of it, which is adenomyosis. Anyways, all the cis and cis, my sister's gonna come here to explain some of the sisters to us so we can have a better, understanding of this. Of course, I know we could go, we could research and everything, but it hits differently when you have somebody who's been through it share it. And we're looking especially from her perspective because this is what we're celebrating this month, celebrating women who are making impact. And I see this lady creating impact in her community and spreading that awareness across, her sisterhood. So I'm super excited. Let me bring on Grace to come and share this excitement. Then we'll bring on our guest. Our guest is also on a high level like us. So I'm super excited that this session today is going to be interesting.
The coincidence is just doing
It's
me
coincidence.
like, you know how we like to say that there are no coincidences, that when things happen and then you get to see it happen or it's another thing
There's an
happens
alignment
that connects with it, there is an alignment. And that's why I'm super, super pumped up today. I'm excited. Exactly 9 years ago, we had a walk, and we're just saying it backstage that 9 years ago, we had a walk talking about endometriosis, creating awareness. And our guest said, 9 years ago? Really? Yes, 9 years ago, we had this walk. And today, we're going to be talking about it again. So it's the universe saying that someone is about to be blessed. I don't know. Calm me down, baby. Calm me down. I like when God speaks. It's thunderous and it's like, here it is. So today we're going to delve deep into the conversation, and I'm very sure that many people will be helped today. The awareness is going to help people struggling to get the help that they need.
Absolutely, absolutely. So please, this is a good time to invite somebody that you know. Share this link with somebody, especially a sister, a mom, a guardian of a girl child. And a video we saw earlier today, yesterday and today on our guests, Instagram page, of a BBC. Almost like a docu series about, or like an info video about this endometriosis, is on a child, a young girl, a high school kid, right? So it means that age might not be a determining factor. So a young girl could have it as, I guess is going to talk more about it, as early as this is the first time this girl is seeing her period. It can be there as well as older people. So please share this link with somebody you know who should be listening and being a part of this conversation. So without further ado, we're going to bring up our guest and we'll just dive right into the conversation. Hello, hello, hello.
Hello, hello.
Uh,
Friday.
Welcome, welcome,
Hi.
welcome.
Thanks for having me. I'm super excited here. This is all eager to do to, spread awareness. Very much a lot of women doing, and someone who has actually experienced both adenomyosis and adenomyosis. I know what it is like thing, and I always say I do not pray it for my enemies. So that's the
mm,
reason when the opportunity is so pumped on it. So thank you so much for, inviting. I'm super excited so
okay,
much today. Yeah.
we speak against this network. This network is showing itself. I'm not liking the sound of that. So your audio is kind of breaking in and out. So I'm hoping that it will adjust itself so that we can hear you clearly, because we need to hear this.
Ooh,
We
can
need
you hear
to, yeah.
me now?
So,
Oh, good.
yeah, it's breaking. Your audio is breaking, as well
Oh,
as your
goodness.
visuals. But let's see how it goes. Anyways, thank you so much for also saying yes, and for the work that you're doing with the community of women, sharing your own
Mm,
story. Like I said, it's not an easy task, but stepping
mm,
beyond the pain that you are experiencing to say, you know what, I do not pray this even over my enemies. So that means
mm,
anybody who needs to hear around me needs to know, so that they can be able to walk through this, so they don't have to go through the extreme pains that you have gone through. But before we dive right into the conversation around endometriosis and adenomyosis, who is Jennifer? I know we have your profile in the description of this episode, but want to hear from you again. Tell us, introduce yourself in a way that is memorable for us to remember you. Who is Jennifer Oni?
mm. Eh, so how do I so to put everything out together? Okay, and I can you hear me clearly?
It's still breaking.
Oh
Um,
goodness. No way.
no, no,
Is
this
it
is not
is it
what
really
we want to
breaking?
see.
Okay, I think it's a little bit better now.
Okay. I think I'm just gonna switch to it. I think it's gonna be better than this
Okay, you're switching,
Wi-Fi.
right? Yeah,
Yeah, let
maybe if
me
you have
to
data,
my
yeah, maybe
data.
switch to your, yes, yes, it might be better. That might be
Okay.
better. Yeah.
Just bear with me. It's seamless. Okay. I'm doing just that.
Okay, while we're waiting for
Okay.
Jennifer to switch
Mm,
her network, because we really need to hear her clearly. Please let us know where you're connecting from, if you're watching on Instagram, on LinkedIn, on YouTube, wherever you're watching from. You just drop a hi in the comment. Let us know you are there. We want this to be as interactive as possible as well. Have you had anyone with the same experience? Have you heard about endometriosis before? What are your takes on it? Have you seen anyone experience it around you, tell us what are your experiences around this particular condition. Let us know in the comments. Engage with us. Let us have a conversation with you as we wait for our guest to switch her network so that she's able to speak on this topic. But Gracie, when your friend, okay, you said it's been 9 years. How is your friend doing now? You said she was diagnosed at the time. What would you say about her journey since then till now?
All right. So the friend that did the work was not the friend with endometriosis. She
I
read
see.
about it somewhere, and it dawned on her that maybe somehow, because she was very particular about women and some of their struggles, so she picked
Hmm.
that particular she picked endometriosis because it wasn't popular at the time. So
Hmm.
we, like I was sharing that, which one is endometriosis? Where are you coming from with this? Or what do you want us to? So it made us, we Googled, we checked it, and then she now said that she was doing it. She was not personally suffering she was not suffering from it, but she wanted to
Hmm.
just throw light. So we have our beautiful, you're very gorgeous, by the way, pretty Jennifer. So we'd like for you to speak so we know
Thank
you
you.
can your network is good now.
Okay, yes. So can you hear me now? Because I've switched.
I think it sounds better. So
I think it
yes.
should be better now.
Yes, it sounds better. Yes, please go for it.
Okay. All right. So let me go ahead to introduce myself. My name is Jennifer Oni. I'm a wife and a mom of two amazing girls, 14 and 13. And I am an
No.
entrepreneur. My business is about 14 years now. I run a bakery. I used to run my bakery in Nigeria. I had like a full-time bakery with staffs and all of that before I relocated to the UAE. Because it's a new space, and I'm trying to penetrate the market here. Can you still hear?
Yeah.
Yes, we can. It's breaking, but we can. We can. Yep. Okay, now it's like it's late. We can
Can
hear
you hear
you.
me?
Yes. Yes, we can hear you. So now it's lagging. Oh no. Network today. No, don't do this to us, network. Don't do this to us, network.
I hope it switches. I mean, we're not afraid of network issues because we still go ahead to do our thing. Network
Before.
better obey. Network better obey. Okay, she's back. She's back.
Let's try again.
So can you see me now?
Yes.
Yes.
Okay, where did I stop?
You said you
You
were an
stopped where you
entrepreneur.
mentioned a new market that you
Yes.
when you relocated, you realized
Okay,
that
where did I
the
stop, please?
yeah.
Did you get
The,
that? So I think there's a lag.
mm,
There's a lag. Yeah.
Yeah, you were talking about
Oh.
moving into the new markets in the UAE.
Okay. So yeah, I'm doing that with my bakery, and I am currently trying to venture into a more healthy line, because I know I can't eat the cakes that I make now. Also on that line, people are more conscious of their health nowadays. So
mm,
taking courses to have a healthy line, a healthy bakery line, where everything is healthy. You can eat treats that are tasty and healthy at the same time. So I'm venturing into that. And aside the bakery side, I'm also a business. I just recently joined a company where we do business full package for new businesses in Dubai, registering the startups and the licenses and the visas, the golden visas. We do all of that to get that. And then I also advocate for women's reproductive health because I realize that a lot of women are not aware about their reproductive health. Um, Majority of us just go, running on an empty tank. Like we're just so focused on work, family. We're not focused. We don't care about ourselves. I'm not sure if I'm
We can
being
hear
heard
you.
right now.
Yeah, we hear
Oh
you.
goodness, this Wi-Fi is giving issues.
We can hear
We
you
hear
though.
you though.
Hello.
We can hear you. Okay, so I think maybe on our end she's probably frozen. And so I don't know if we allow her go audio only, if that would help. I don't know.
Hello.
We can hear you. We can hear you, Jennifer.
Hello.
We can hear you.
Mhm.
Okay, let me take her out. Let me she leaves and joins again. Let's see if that works. Um Please, Gracie, you were saying something about your friend. Complete your thought on that. Let's
Okay,
see.
so it was a case of someone that heard of something very in her in that time. It was like it was weird, and she was like, if it can happen to women, it could happen to anyone. So she
Hmm.
wanted to throw more light. She wanted us to just help her create the awareness. So it was a walk so that people would even hear. So the beautiful thing about creating awareness is when people hear of something, thank God for Google, they'll just run. Something that they
Hmm.
never knew existed. They will just run to Google and then they will Google it, and Google would give them the information. And in situations like that, because I already knew, no, I didn't know about it. My secondary school friend, she used to suffer, her menstruation used to be extra. We'll be like,
Hmm.
we all menstruate now. Why is it that this our
That's the one
sister's
difference.
own is always extra? But because as a loving friend, we would just, stick around and just help her get well,
Through
so to
it.
speak, because
Hmm.
we would rush her
Hmm.
to the hospital. And the nurses back then again, because they also didn't
They
know
didn't know
much,
better. Yeah.
they didn't know better, because
Hmm.
one thing about medicine as well is it's a continuum.
It's so big.
Yes, people are still discovering things. And so it was just our small health center. So the nurses were like, what you're looking for?
What? It's not
Because most times when you're sick, when you're sick, you're looking for them
pregnant.
to give you exits or something so that you go home. So they would go there, they would insult her. In fact, there was an
Hmm.
incident. We went there, the woman said, "What's wrong with you?" And then she said that she's having menstrual cramp and that it's
Hmm.
very painful. This and that. The woman said, "My friend, will you go and sit down? Are you the first person having menstrual? Come on, go and sit down somewhere." Blah, blah.
Hmm.
When she started vomiting, when she was throwing up
Oh,
and really vomiting. Okay, can you hear us now?
oh. Yeah, I can. I can.
Yeah, yeah, yeah. Yeah, complete your thoughts and then let's see
Yeah.
whether that
So
will
it
warm
was it
that
was
will warm
it
it
was
up.
when the woman saw that this one is no longer on ordinary menstruation. No, she was throwing up. She was looking pale. She was looking like she was going. So we, our friends, were like, "Ma, see, we're shaking. We're telling her that, ma, you have to be very serious. This is not just ordinary. This is how." Before they now took it seriously and they now gave her pain relievers, and then she now calmed down. Even with the pain reliever, she was still looking somehow,
Weak.
but we didn't know what it was then. It was
Mm.
it
Oh,
was just
Wow.
a case of a painful menstruation, so to speak.
Hmm.
But I'm
oh.
sure we'll learn more from our guests.
Absolutely. Absolutely. Let's
Yes,
give it a shot again, Jennifer. Yes,
I
please go
really
for it.
pray this doesn't go off again so that it can flow very well.
Right.
Okay, so that's enough about me. I'm okay. let me just go straight into it. Okay, so I've been just, as I've introduced myself briefly, what made me to go full on for this women's reproductive health awareness? Initially, I was just focused on endometriosis. But I then realized that from my endometriosis post, a lot of women used to send me messages on my Instagram, and they would tell me of other things that have happened to them from after having been diagnosed with endometriosis. So you see, endometriosis is not just a reproductive health issue. It's a full body issue. And it's not only endometriosis women, we have uterus, we have adenomyosis, we have adhesions even overlooked. We have adhesions ourselves every month. And there needs to be awareness that there's so body that is often overlooked because we are women. And because, there is this thing that, okay, number one, every woman will have a menstruation. Every woman is expected to get pregnant and have a child and go through labor. So it's seen that, okay, you're having a menstruation. It's normal to have menstrual pain. It is normal for you to go through labor and have kids. So if a woman comes up and starts giving this painful periods, or you're coming up with some symptoms that comes along with your menstruation, it's overlooked. Most of the symptoms that women have is usually centered around the hormones. Like, okay, it's the hormones have something to do with it. Oh, I'm not sure if I'm being heard. I don't know if I should
We can
continue
hear you. We can
speaking.
hear you. It's lagging, but we kind of catch it towards
What's
the
this
end.
one
So
for
it's
like
almost
this?
like,
Can you hear me?
yeah, yes. Can you
I'm
hear
going to
us
change
too?
location.
Okay, so you want to change location, right? Okay, she's gone. All right, so we'll wait for her. Let's see if she can change our location so that we could continue in the conversation. But just with the story you're saying, um I remembered also, I had two colleagues back in the days, that whenever they were on their period, it was when the whole town would just know that, okay, that time of the like the whole office will just know that, it's that time of the month. You can't even hide it because they have to take off. One of them would I had the opportunity to stay with her for a period, and I'm like, I used to wonder, like, hey, really? Omo, for those of us that don't have any, like, sometimes if you will not even realize until you're almost somebody is pointing to you like, you're like, I did not even know it was going to come today because nothing is happening, and then this is somebody going through almost something you can call hell. She would be on the floor, rolling from one end to the other,
Mm.
crying, throwing up, rushing to as in, and I'm like, taking all sort of Buscopan, all the pans, the ibuprofen, just to,
Mm.
water down the pain. And we used to wonder, like, this thing, but when we're growing up, there was a lot of assumptions and what our moms then would kuku say. They didn't know better now. They say, all these
Yeah,
things, don't worry, when you give birth like this now,
it will
everything will
stop.
go. Like once you give birth like this, everything will stop, like, because the pain of labor, will be stronger than this one, so it will go. But and it's interesting that, like you said about health, medicine. It's interesting that there's a lot that we don't know, because we don't have anyone experiencing it around us.
That's right.
So it doesn't even give us the um interest to even check it out, right? And even when you experience it, maybe slightly, it's still not strong enough for you um to want to. Okay, so I think she's back. Let me try again. To want to just dig deeper because you feel like maybe it's just a one-off or it's a particular. Now we can also mystify things. Maybe this one is village people, But thank God for for
Praise God.
tech. Thank God for yeah, she's
I
back.
think it's better now.
I
I
think it's
hope.
better now.
I think so.
I
Please
had to
stay.
move. Okay.
Let's see.
Okay, so let me just quickly go back again. So what I
Yeah.
was saying was what really motivated me to do this was because after I experienced like a back to back with surgeries and all of that with endometriosis, and then I just shared what I went through on Instagram. Someone messaged me, and she was Indian, and she was in India, and she was telling me almost the exact same thing that happened to me happened to her. And I was like, wow, so this thing is really, it's really happening. And someone else sends me a message too and says, oh, I can totally relate. I'm actually having surgery today. And then I get another message again. You see, I was always getting these messages. And I said, no, something needs to be done about this thing because most of us had the same timeline of being dismissed by doctors and being misdiagnosed. So I told myself, I said, I need to come out with this thing. Initially, my siblings, some of them were like, should you be coming out saying all these things happening to you? It's not safe. Like, why would you come out saying these things? They're supposed to be personal. But I'm like, I know what it is like. Not that what actually made me to know I had endometriosis was someone's post on Instagram, actually. I was just scrolling and I saw the lady, the way she was positioned and she was crying. I hadn't even read the caption, but I saw her position and I was like, what? As in, like, this is me.
You
Do you
could relate.
understand?
Mm,
I hadn't read the caption. I don't know I've not even heard anything. So I stopped to read and see what it was about. I was just like, oh, I was crying. I took my phone to my husband and I said, look at this lady. This is what I've been dealing with. Look at what she's saying. And my husband was like, and that was when we started to research. That was the first time we would hear about endometriosis, which was
Mm.
2019. That was the first time we would hear about endometriosis. Yeah. So we had to, start researching and then start looking for specialists and all of that to find out what exactly was happening. So that is what really motivated me to come out and create awareness because a lot of people do not know they are dealing with this thing. Meanwhile, they are being treated for so many other diseases, not knowing that
things.
this is what they are dealing with. So this is what is
Mm,
actually motivating me. And another thing motivating me is the complexity of the condition itself. At one
mm,
point, you think that you have made headway, you think you've
Mm.
gotten it, you've wrapped the thing, you've grabbed it by the horn, and you are actually doing well. And then it comes and tells you, hey, you don't know anything, I just started with you. You
mm,
understand? So the thing is so crazy, and it keeps making me want to research and try out different things and come out there to let people know what this thing
mm.
really is.
Wow.
So
Amazing.
yeah. So before I start to explain what endometriosis is, okay, now I think I would talk about what endometriosis is and adenomyosis so that people that don't know can know what we're talking
Right.
about.
Right.
All right. So there's so many definitions out there, but the most basic one and most simplest thing for you to understand is I even just saw one recently that kind of cancels what we've known
You knew.
before. Yes.
Wow.
I, I just found one new. Was it day before yesterday? I saw that. Okay, so endometriosis basically is a tissue that is similar to the lining of the uterus that just grows anywhere in the body.
Mm.
We've seen cases where it was in a lady's brain, she died. It
Ouch.
was in a lady's brain. It's in some people's lungs,
Ah.
on the diaphragm. It's in the kidney, it's on the bowel, it's in the bladder, it can be anywhere. It's on the heart.
Anywhere. Oh,
Wow.
wow.
So this tissue can be found anywhere in the body. And that's the reason why we keep advocating that this is not a reproductive health disease. So it should stop being treated as such. It can be found. And now
Mm,
imagine something that shouldn't be where it is in the body. Definitely, it will be causing inflammation there. It will be causing the
right.
organ
Pain.
to malfunction as well.
Mm,
So imagine someone coming every month when your period is about to start, and then you're having difficulty breathing. If you go to the hospital, they wouldn't even relate it to anything
2 years.
because you're having this, or you're coughing out blood during your period. They would not even relate it at all, like, oh, this could be endometriosis. So that's the reason why they're making noise, so that at least it could
About
be
it.
one, yeah, it could be one
One of the things that they will check
the things that they check for. So that's endometriosis actually. But, adenomyosis on the other hand is endometriosis sister, but it stays inside the
the uterus.
uterus. There is not,
Oh,
yes, it's not found outside. So adenomyosis is a reproductive health disease because once you take out the uterus, you can never have adenomyosis anymore. So it
ah,
can be found only inside the uterus,
the
but
uterus.
endometriosis can be found anywhere.
Anywhere.
But that's the difference between the both of them. Now, for me to now, before I go further into it, another thing people say is that, like that lady, like the girl in the post that I shared last night. The
Mm,
girl, she's a young girl. She just started her period, and it's crazy like that, right? And they're telling her, "Oh, you can't have endometriosis because you're too
you're too
young to have
young.
endometriosis." Do you know that endometriosis can affect any woman as long as you have the uterus? You can have endometriosis. So it doesn't know age or anything. And even some people that are not even seeing their period, I've seen some cases, some studies where a 10-year-old, a 12-year-old that hasn't even started menstruation has endometriosis.
Wow.
So it's not only when you have started your period that you can have it, because even women in menopause
Ah,
have
They can also,
endometriosis.
wow. Hmm.
So it's not like it's only if you're having your period. So I just wanted to start with these few
With that.
facts before,
Hmm.
yeah, before we go deep into it. So now the way I wrote the topic, is I said endometriosis adenomyosis and the silent
And the silent
struggles,
struggles.
the
Mm,
struggles. I call it the silent struggle because we are silenced. You come out and say this pain is unbearable. They tell you you are being
mm,
petty. They tell you you're supposed
mm.
to stop it up. Like,
Be
are you the
strong
first person to have a menstrual pain? I'm like, it's menstrual pain, it's normal. One of the major things you're advocating is menstrual pain is not supposed to disrupt your daily activity. Any menstrual cycle you have that is interrupting your daily activity is not normal.
Mm,
It's normal for you to experience some pain from the contraction and all of that, another scientific thing that they always say happens during your menstruation.
period. Mm.
But it shouldn't interrupt you. It shouldn't change your position, like you can't even stand straight.
Sit
It
up.
shouldn't,
Mm.
no, no. If that is happening, visit your
Go check.
your
Go check.
gynecologist for a check. Yes, it is not normal. It might not be endometriosis, it might not be adenomyosis, it could be fibroids, it could be many other reproductive health disease, but it might not be
Mm.
endometriosis, but it is not normal. Absolutely not normal. So we need to break that silence where they come and say it's normal to have menstrual pain. Passing out clots of blood during your menstruation is absolutely not normal. You're
Normal.
not
Mm.
supposed to be passing out clots of blood. I remember when I was in secondary school in the boarding house, there was this senior, and she just took a shower and she was going just from the bathroom to the room, which is just like how many steps away. And she was going to a bed like this. Like I've never seen such a thing in my life before. Huge clumps of blood was dropping down, thump, 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 on the floor. I was like, what? I've seen such a thing
Wow.
in my life before. So, when I started going through this endometriosis and I started
Your
remembering,
voice
I said,
is faint. I don't know. Your voice is really faint.
oh goodness, can you hear me now?
Yeah, better.
Yes,
Yeah,
better.
better.
Oh, okay. Okay, sorry about that. Okay, so when I realized that when I started dealing with endometriosis, I remember that senior that
Hmm.
used to have that huge clot of blood pouring out during that period. So these are let me just go through some of the symptoms of endometriosis.
Right, right.
All right. So first of all, um, the level of your pain during your menstruation doesn't determine the severity of the endometriosis. Some
Hmm.
people have stage 4 endometriosis and they don't have so much pain. Some people might not have so much pain. Some might have stage 1 endometriosis and
Have
they are
heavy pains.
completely
Severe pain.
incapacitated during their periods. Yes. So it doesn't determine the severity of the endometriosis. Pain is just one of the many symptoms of
Symptoms. Hmm.
endometriosis. Yes.
Hmm.
And this pain is not limited to um, the menstruation and the menstrual cycle. The pain
Okay.
could be before the menstruation, it could be during, it could be after, it could be
After.
throughout.
Hmm.
Mm.
So one of the symptoms is pain during ovulation, pain during menstruation. See, don't let me say pain, severe chronic pain during
Pain.
menstruation
Hmm.
and during ovulation, and even after, even before and after. It's just crazy. Then
Wow.
there is also huge clots of blood during your
The
menstruation.
menstruation. Hmm.
There is irregular menstrual cycle, like your periods could
Cycle.
come whenever it feels like coming, and it could last for up to 7 days or even 10 days, and it will be heavy all through. There
Hmm.
is also digestive issues as well. And this is often misdiagnosed as IBS in most patients. Like they'll keep treating you for IBS because
What's
it has
IBS, please? Elaborate
that's
that.
okay, that's irritable bowel syndrome.
Right.
A lot of people that have endometriosis actually have irritable bowel syndrome. A
Hmm.
lot of women, they have that because it affects the guts. There is this I don't know if you notice, a lot of women when doing their menstruation, some women have constipation or diarrhea,
Or bloating. Hmm. Yes, yes, yes.
bloating as well. So this could be is also like signs of endometriosis as well. But when I had a consultation with my doctor last week, she mentioned to me that when she was explaining some things to me, she mentioned that um, there's something that is released in the body, the hormone, an hormone or something that causes some kind of, diarrhea or something during your menstruation. But it's not supposed to
Hmm.
be like, it will be much, like you'll be so constipated or you'll be having severe diarrhea. No, it's not supposed to be like that. But there is something that
Hmm.
happens. It's supposed to just be mild,
Mild.
nothing to be concerned about. But when it
Hmm.
becomes a thing, like for me, for instance, I used to have the severe chronic pain, like I cannot even stand straight, I can't do anything. I used to have the clots of blood. I used to have the diarrhea,
Hmm.
like you can't even like you like you have food
It's like
poisoning
you're
Every
staying
kind
with
of
month,
the pain.
every month. Is it
every
every
single
month?
month, every single
Ah,
month.
Wow. Wow.
I
ah,
used to
ah.
have the the diarrhea, then the pain during the ovulation as well. Like before the period comes, let's say the period is like 5 days before the period, I'm already as if I am on my period. Like 5 days before
Ah,
the period, like the
It's
pain
so
is
wow.
mad.
traumatic already.
Then the period comes, and then it's like worse.
Like
And then
it heightens.
then after the period, it is so I used to have like a week of sanity, like a week.
Whoa. In a month.
Yes.
Yeah,
Yeah.
because before, after almost 3 weeks gone. Wow.
So That was, imagine you use a pad, like the thickest pad, the heaviest pad, and you use the heaviest tampon. And within 1 hour, you're stained.
Combined though.
Yeah.
Wow.
So that's how crazy endometriosis. And adenoma, when I say and these things, it's the same thing with adenomyosis, actually. The same. Okay, so these
Mm.
are so much. And then there's also painful intercourse, nothing wants to even, nothing should even just go there at all. It should be as if
Mm.
a knife, no matter how you say you want to be gentle or you want to be anything, it should be like there is a knife stabbing you and
Stabbing.
twisting right there.
Wow.
Yes.
That's a
And then
Wow.
lot.
let's talk about the what's it called now. And this pain I'm talking about, like the intercourse pain, is not like it's during your menstruation you have the pain. Like every normal day.
Oh,
And it doesn't have to be during your cycle,
man, that
any
can
day
be whoa.
at
Like
all.
this is so deep because that can be a
Yeah.
whole. That can lead to a whole different kind of
Different
struggle
kind of
in the
struggle.
marriage.
Yeah.
Yes,
Yeah.
because
Mental
if the man
struggle.
does not
You're not looking
understand
forward to enjoying sex. You're not looking
No.
forward
exactly
to your menstruation.
to your
You're not looking
menstruation,
for.
like
You're just like, wow.
my
Exactly.
God,
So it's a full body, whole life disrupting disease.
Yes.
absolutely.
Okay. All right. So for the endometriosis, the other symptoms I mentioned, it's common amongst, like we've seen cases of several women having this issue, and these are common. There are some that we don't even know about, and these are
Hmm.
like the ones that have to do with the affected organs. Like I said, it can be found on any organ in the body.
Any
So
organ,
imagine now,
right?
this ones I'm talking about now are the ones related to the pelvic region,
The
the
uterus and everything.
uterus, the
Yeah.
fallopian tubes, the ovaries. And let's before I forget, most people that have endometriosis, they always have issues like ovarian cysts. You'll just keep having
Mm.
ovarian cysts, yes. And then adhesions as well. Adhesions is when there's like this band kind of thing forming in the pelvic region. And this is caused by inflammation in the pelvic region. Anybody who has had a C-section or any abdominal surgery can have adhesions because it's when the body is trying to heal itself.
Heal. Mm.
Yeah. So there's this, like if you have a wound, for instance, on your hand and it's healing on the outside, on the inside, some of this scar tissue will be forming inside to like heal itself to protect the body from infection inside. So now
Right.
I learned that with time, adhesions are supposed to like just relax and but it becomes an issue when the adhesions refuses to like just relax and free up and everything. So most women that have endometriosis, because that cell is where it shouldn't be in the body. If it's in the pelvic region, maybe on the bowel, on the bladder, on the kidney, fallopian tube, it will be causing inflammation in this area and it will be forming adhesions there. So now
Hmm.
these adhesions on its own is another ailment on its own
Lots of
because
pain.
it's
Hmm.
it's I read then that adhesions are like they said it's like if adhesion is attached to an organ, imagine an elephant pulling that organ. That was what they used to describe um
Wow.
the strength of the band.
The
So now
Oh my,
pain.
this is scary. Wait,
I
wait,
know.
wait.
so
This is so
I'm telling you,
scary.
it's a
Like,
whole lot. It's a
ah,
whole
No
lot.
wonder, no one. And now I get it when you say you don't even pray it on your enemies because
Yes.
I cannot imagine, like, even this explanation you're giving now. I can imagine it like, like the scar tissue trying to form, but this thing you're
Mm,
saying is trying to stretch it out instead. So, you know how babies, when babies are groaning, it's like,
mm.
is this
Yeah,
a nerve
yeah,
that is
yeah,
doing
yeah,
them?
yeah,
And they'll be
yeah,
doing like this. It will do like it's doing them like this. So I can imagine, like,
yeah.
imagine an adult having that kind of like spasm or something. Whoosh.
Yeah, exactly, like spasms. Exactly. So in the um what how these adhesions also affect endometriosis patients is that it causes frozen pelvis. Now,
Huh.
frozen pelvis is when all the organs in the abdomen, for instance, they leave their respective positions and just gums to the abdominal wall.
Ha.
And is adhesions causes this. This happened to me.
Ah.
Like all the organs, they were not in their where they should be. They were all plastered, like they will be plastered to each other and then to be plastered to the abdominal wall. So
Ah,
How did you how did you
so
how did you navigate that?
you're a powerful
this
woman.
this
Ah,
this one on its own causes another kind of pain. No, imagine your organs are not where it should be, and then they are attached to the abdominal wall. They won't function the way they're supposed to function.
yes.
I was having what's it called now? Um, disruption. What do they call it? Obstruction? Yeah, I was having intestinal obstruction because all the
Mm.
adhesions was tying, the intestine, and food won't pass
What? Yes,
the
what
way
that
it
happens,
should
you throw
pass.
up or
I was
How do you go to
I
toilet? How
was
do you?
hospitalized. I had to have an enema done.
tube.
There was
Oh my
a tube
god.
passed from my nose down to my stomach to empty my stomach, and then there was an enema done to empty the intestine. So these are the things that people with endometriosis suffer. Now, what I wanted to say, and this thing is not like every doctor knows this. That's why we
Mm.
need this awareness. When I had mine, I had been suffering for a long time. I would go to the hospital. I had ovarian cyst surgery done 2 different times back to back. I was always having ovarian cysts. I had the surgery done. They took out the first ovary, and I was just like 20. I was about maybe 26 or 27
And
when I had
you
to
had
take.
given birth before this, or it was
Yes,
after?
yes, yes, yes. No, I had given birth to my 2 kids
Ha.
before I started having the surgeries. Yeah. But you see, I've been
Wow.
having all of this before um
Before you gave birth, before you got
You got
married and
got
pregnant.
pregnant.
wow.
Yes, but I never knew. In fact, people used to tell me that I'm lucky that I was even able to have kids because a lot of
Yeah.
people with endometriosis have issues. They have like fertility issues. Yeah. So, but for mine, I was able to get pregnant. But my first pregnancy, after my first pregnancy, was when I started noticing that it was worse for me. I started having all sorts of things that doctors didn't know. I believe that from now I know that it was
You know
adenomyosis they
better.
were seeing. But the doctors were saying
Yeah.
they said I had fluid in my uterus, not knowing it was adenomyosis. So they were treating me for
Mm.
infection
Hey,
that never went.
God.
hey.
So fast forward 2 years after my first child, I took in my second child, and from the moment they said, in fact, how I knew I was pregnant because I still saw my period, and the next thing I was having so much pain. I was in so much pain. I went to the hospital, and then they said, "Congratulations, you are pregnant." I said, "If I am pregnant, why am I having this kind of pain? Then that means something is
Pain.
wrong." And then I did a scan. They didn't see the baby. I was scared. After 3 weeks, before they saw the baby, the tiny pain, I was like, so why is this tiny pain giving me issues? If I turn to the left, I feel a ball drop. If I turn to the right, I feel a ball drop. But it's still tiny. So what is going on? They never knew what was wrong. From that moment, I was sick. I didn't go home until I had my baby.
9 months.
I had to have her the first week of the 8th month. The water finally broke, and then I had to deliver the baby. And I now had a C-section because I was having contractions from the third month. From the third
Ha.
month, I was having
Whew.
contractions back to back, back to back.
Girl, you are a
I
strong
was,
woman.
when I remember what I went through, I just look up, I just say, God, thank you that I'm still alive and still here. I wouldn't lie, there were times when I became suicidal, actually.
Because
I
the
was like,
pain was too much.
I said, what's the point? Like, what's the point? When I was carrying my second that pregnancy, I and my husband, we told the doctor, we are done. Like, we would try to have another baby later. My life is more important, like it's still a very tiny, just take it away, because I was having contraction almost every day. And at the end of the day, they would think I will have the baby, then the contraction will stop. And then another day, the second day will come again, same thing. But as God will have it for me, I was able to keep the pregnancy up until the first week of the 8th month. The water finally broke.
Mm.
And then there was now no more contraction. The contraction that was coming every day did not now come again.
Wow.
So then I had to
Wow.
do a C-section for me. And the baby was perfectly fine. It was, I was thinking she would need incubator or all of that, but she was very fine. So now that I now started dealing with the endometriosis, was when we now discovered, the doctor now said, oh, it was endometriosis that was the adenomyosis and endometriosis was what was making that pregnancy difficult for me. You understand? So we
Mm.
didn't, then they didn't know that it was the adenomyosis I had, do you know?
Right.
So after I had my daughter in 2011, after I had her, let me say the beginning of another set of nightmare for
Wow.
me. It was horrible. The period pains became worse. I was like, but they said after you have kids, this thing will
You
go
to
and stuff like
reduce.
that.
Mm.
It will reach. Mine was horrible, from ovarian cyst to ovarian cyst. Then fast forward from 2011 down up to like 2016, it became so bad. I had already had two surgeries before 2016. I had 2014, 2015. Then
Mm.
2016, it was horrible for me. And then I continued to deal with this endometriosis and adenomyosis. I didn't know I had endometriosis and adenomyosis until 2018, when I stumbled upon that lady's page, and
Right.
I said, oh, babe, it's like, this is called endometriosis. Let's look for a doctor that would
Let's find
know
out.
what
Mm.
this is. But we couldn't find any doctor. I would go to a hospital, like a very big, well-known hospital, and I'll be in so much pain, crying and everything. They'll say, what's wrong with you? But you have two children now. Should you not normal delivery you had? You know how labor is, that what's wrong with you that you're now being so petty and everything. They will say funny things to you.
Oh.
And then even there was a nurse that came to me one time and said, I have spiritual problems that I need to go for deliverance.
I knew that one was coming. I knew that one should be there because it's a no-brainer.
Yeah. Said you need deliverance, that I need to go and wash my head. I need to go and
Wow.
do where did I put my baby's umbilical cord when I had my
Hey.
child? All those
Hmm.
kind of things,
Ignorance is bliss.
I'm telling you. So, but yes, another side of it as well is, the prayers part and everything. Yes, with our faith and everything, we believe that there is nothing God cannot do.
Right.
We didn't relax on that side either. We were always, one thing about me is that I and my husband actually, we are the kind of Christians that we are totally against you going to God because you need something from Him. Like having a relationship with Him because you need
Mm.
something from Him. No,
Yeah.
we hold our relationship with God so dear that we are like, okay, He's our Father. We have that relationship with Him, but it's not we're not with Him because we need Him to do something for us. We are with Him because we recognize His power, His might. We know that He's literally our Father. So we have that
Mm.
father-to-child relationship with Him, right? So before all this sickness and issues and everything, we have a very good relationship with our God. We serve this God that always answers every single prayer that we pray. And then this whole issue started, and then my husband took it upon himself. My husband went on how many months fasting? He said, if I am not well, he's not going to stop fasting.
Wow.
My husband was like a stick of broom. He was like a stick of broom. He said, if this thing is not, I'm not going to stop fasting. I was begging him, please eat, please eat. He will break his fast with water. With water. He won't eat food. And
Shout
it
out to
was
your husband,
God
please.
bless
We need to
him.
shout
God
out to
bless
him.
him.
Shout out to your
God
God
bless
bless
husband.
him.
him.
God
If
bless
you're
him
watching
indeed.
this,
And
if you're going to watch this
yeah,
later, shout out to you.
and I must say that I'm so blessed to have such a man. And it's not because maybe I'm trying to hype myself or hype my husband or anything,
Please
because this
hype.
is some
It is so hype.
this is
Please. No. Not trying to be humble. Hype yourself, hype your husband.
no,
You see,
this is
you
Easy.
see
the
me, I'm feeling cold just listening to you. Then you that
you
Hmm.
know
you were
you
in pain.
Ha.
Ah,
you mentioned something that this is a condition that can affect a serious part of your life, even your marriage as well, your home.
Yeah.
And
Yeah.
the way my parents actually said this thing to my husband, and not even just my parents, even our pastors then in Nigeria. when they came to, because they all knew, because I've always been, I didn't even mention when I was introducing myself, I'm a worshiper, a worship leader, and I've been one since I was like 16. So my pastors, I'm always very active in church, the worship team and everything. So all this while that I was hospitalized and everything, the church was always so like, and my church is a very like the provincial headquarters. They
Hmm.
a very big church, and every single person is after my well-being. You understand? They had to
Hmm.
come out and say, "Oh God, Mr. Aweni, you are a man. Like nobody will even know that you are going through this. Like you are a man." Even my dad, my mom, they're like, "Oh no." So my parents didn't really know how severe things were until I was like I think I passed out or something. My mom had to take me to the hospital, and then my mom got to experience my normal. That was my
Pain.
normal every day
Wow.
that my mom got to experience, and my mom was she was weeping.
Cry. I can imagine. Oof.
She said, "Is this what your husband has been going through every day, and it's not showing on him? Like, like how? Do you understand? My children were still very little. My kids were like maybe 5 when this thing became very bad. And my husband was the mom, he was the everything. My husband would be the one to
Mm,
prepare their school lunch, take them to school, pick them from school, take me to the hospital, bring me back from the hospital. And it never showed that he was dealing with something like that. As in nobody would
God
ever
bless
know.
him.
You
God
understand? And
bless
even
him.
till now, that I am even able to manage. I mean, my mom calls my husband Dr. Remy because my husband had to become a doctor. He used to find
Wow.
research. He even knows more than the doctor. I mean, if it comes to you as a doctor, just be prepared because you're my husband. Just be prepared. He knows more than doctor says. And he took it upon himself. And it doesn't take. I'm so grateful to God that He gave me such a man that doesn't joke with my health
Mm,
at all. Like every single
mm.
thing I want to eat, he has to vet my food. No, you cannot eat that. No, you must not eat that. No, what are you eating? What do I see in your bag? You must not, it's always checking what I eat.
Oh,
And till today, till today, he doesn't allow me to do so many things like trusting myself, cooking, and he will cook. Like, please don't stress yourself. Please. I don't want you to stress. Stress too triggers endometriosis flares when your cortisol level is high and all of that. So it makes endometriosis worse.
Mm.
So, I
whew,
thank God for him. Anyway, it's
this is
really helped me.
heavy.
And one thing with endometriosis is if you do not have a good support system, oh God.
Ah,
It's finished though because it's
Um,
tough. It's a
yes,
lot.
very, very tough. I have people that have come to me on Instagram and they've shared how, like, single ladies or only child, or maybe you don't have parents that are capable, or even you are the one taking care of your parents, and you don't have any support system whatsoever. It's very, very difficult.
Mm,
Very difficult. How
mm.
do you get up from there? How do you feed yourself? You can't even keep a job. If you are a student, you can't go
Right,
to
because
school.
you're always in pain. You always have to
Always
ask
in
for
pain.
sick leave. That's a lot.
Yeah. It's a whole lot. In fact, when I had my bakery then, my staffs then, if my staff see this, they will be able to understand what I am saying. There'll be a time when there was a time I was decorating cakes like this. And I just threw everything in my hand. I threw it on the floor like this. The pain just comes unawares. Like you think you're all good, you're
Wow.
fine, you're active, you're doing it. It will just come like someone just
Hi, God
stabbed
of
you.
Jesus.
And,
Hey, Juno,
and
stop
then
thinking about this.
twist the,
I'm like, can you imagine you're crossing
the
the road?
knife.
Do you understand? Can you imagine you're
It
crossing the
happened
road
to
and
me.
the pain just hits?
It I was driving one time. Thank God I had already entered my estate at the moment. I was
Hmm.
driving and this thing gripped me. I just turned the steering, I just turned it and I was just there. This couple driving guy just came and saw me in the car and they were like, "Oh my God, are you okay? Are you okay?" Blah, blah, blah. They were the ones that drove my car. They asked me for my house address. They drove my car to their house. So they called my husband first on the phone. My husband came down to the spot where we were, and then we all drove back to the house. So this thing can just grip you anywhere. Imagine you are crossing the road and the thing just. It happened to me when I was
Exactly.
when I was in Scotland as well. I was on the road. I was going to the train station, and then this thing just beat me on the road. I tried my best to stand up. I was bent like this. I couldn't. And the way the thing will come from the waist down, like the
Down.
back, yeah, like the back, the lower abdomen, the legs, the knee. The pain is always so crazy. Like
Wow.
it's so this
What
what
message would you have really? I mean, it's a lot. It's a lot. Like even just hearing you talk about it
mm,
is it's heavy.
and
Like so I can
I know
imagine you
there's so many.
experiencing that,
There's
day
even
in, day
there's
out
even
over a period of time.
there's even so much I'm not even saying right now because maybe it has been stored in one part of my brain where I don't need to
Right.
remember. Do you
Mm,
understand? So,
mm,
but the major thing is just that okay, this condition exists. Some
right.
doctors they're still oblivious to what
They're not
endometriosis
familiar with it
truly
yet.
is.
Mm,
So, endometriosis adenomyosis is real. And dear viewers, if you are experiencing troublesome, let me just call it troublesome menstrual cycle, it's not
mm,
normal.
mm.
I don't want to be mentioning all these medical terms so that it won't be confusing. But if you have a troublesome menstrual cycle, that
Period. Go
involves
for a check.
daily activities, go for a check. And before you go for a check, do your own research.
Mm.
Nowadays, we have this. Fine, there's all sorts of wrong information out there.
Information online as well.
Yes, but whenever you're researching, you search for not stuff like blog posts or search for stuff that you would see that it is a study from a medical field,
Health,
from
medical
health,
field, yeah,
yes,
like health research.
like Mayo Clinic, like NHS, check for stuff like information from stuff like that. Not like oh someone's blog post. Even my own, if it's my own, I don't have a blog, but if it's my own blog post, even if you read, when you want to make
Still go and check,
decisions,
research.
go and yes, research because you need to look for doctors that are specialized in
Mm,
this field because
right.
endometriosis is it covers it like now someone has it in the brain, in the lungs, in the knee. Do you know some people have it in the in the knee, in the
And and
knee,
and and, and and they'll be
in
treating
the elbow.
arthritis
I try
or rheumatism. Hey Lord.
yes. So we need to meet a health
You need a
practitioner, a
specialist,
gynecologist that
yeah, that is
specializes.
aware.
Yes, if you're in Nigeria and you need a specialist, this one is not, they did not pay me, oh, but they treated me initially, but I couldn't afford the surgery at the time. I had to go somewhere else to do the surgery, but I now ended up coming back
Back
to
to
do that
that
surgery.
place.
To do that surgery, I couldn't afford. I had to come back and do that surgery with them. And it's the
Mm.
hospital is South Shore Women and Children Hospital in I think in Ikoyi or VI. I don't know whether it's Ikoyi or VI. But Dr.
Okay.
Alabi is a specialist in this field. Both fibroids and endometriosis, all this thing. Dr. Alabi is a specialist. Like Dr. Alabi,
Mm.
I didn't need to start. They knew what to do. They knew what to
Mm.
do. Yes.
Mm.
So I can that one I can vouch for that one. They would do all the necessary tests. It's just that it's expensive. It's just that
Right.
it's expensive. Yes, it's quite expensive, but they are specialists in endometriosis, adenomyosis, and then fibroids as well. And they use this laparoscopy surgery. Yeah.
So
So
no
yeah,
cuts.
yeah. So
Mm.
this adenomyosis that we're talking about and endometriosis, where I want to now go to, I've already talked about my personal experience with it
Right.
and all of that.
Experiences, yes.
Yeah, I think I mentioned that it caused me frozen pelvis,
Right.
and that it was that frozen pelvis was unfortunately for our healthcare in Nigeria. Like I said, not all doctors know what they are doing.
Mm.
Then I was doing MRI scan back to back, and they never saw this frozen pelvis. I don't know how come, but it was during the surgery I was having. Thank God I said they should do a laparoscopic surgery first to see what exactly is happening
What is
inside
inside? Mm.
before they do the open surgery. And the doctor said
Right.
if they don't need to do the open surgery, they won't do open surgery. They will just do the
Right.
laparoscopy. Yeah. Thank God they did not just cut into my abdomen. They would have
They
damaged
would
a lot
have,
of my organs.
oh, they would have, oh
Yes.
my God.
So
Oh
they
my
did the
God.
laparoscopy first and saw the frozen pelvis. And
Wow.
then they were now careful to open and detach these
And
organs.
separate. Woof.
Yes. In the process of detaching the organs, okay, that was the first one of the, that was like my third surgery that they did that they saw the frozen pelvis. I signed for another issue we have with our doctors. I signed for a hysterectomy. Hysterectomy is when they take out all the reproductive organs. There's partial hysterectomy and there's total hysterectomy. A partial hysterectomy, they will just take out the uterus and they leave the fallopian tubes and the ovaries.
And the womb. Okay, on the uterus, okay.
They will take out the uterus. So I signed for that. And then they went in, they did laparoscopy and they saw frozen pelvis. The doctor said, oh, it's the frozen pelvis that was causing this woman's pain. So let's just detach it and leave all her organs. Since she's too young to be having hysterectomy, because when you have hysterectomy like that, you'll be in menopause if you have a total hysterectomy. And I came out
Hmm.
of the surgery and then I was hoping to hear good news. And then they told me, oh, madam, we didn't remove anything. We just detached it to the frozen. I said, what? That
Oh,
wasn't what I signed
wow.
for. Because I didn't want to experience that. I was done with menstruation. I did not want menstruation in my life anymore. Because this thing was
Hmm.
just destroying me. I couldn't have a normal life. And then you come to tell me that you didn't
That you
take out
didn't do it?
anything.
Come on.
They said I'll be fine, that was what was causing the pain and everything. I said,
Did
okay.
they refund you or did you sue them or something?
I, I didn't do anything. I said, okay, let's see how it goes. 1 month after,
Oh
I was back in the
no.
theater. And would you believe that the adhesions and the frozen pelvis that they detached a month ago was back?
I've come back together. Oh my God.
Just a space of, it wasn't even up to 1 month, 3 weeks. This is a sign of endometriosis. Most people that have adhesions like this, frozen pelvis like this, there is endometriosis present. And then told the doctor, I said, please take it out. I'm
Take
done.
it out.
Would you believe that I had the surgery after, like the following month, I had surgery in November and I had surgery in December. They took
Wow.
out only the uterus and they left the ovary and fallopian tube. They left it. They said
But you wanted them
it's
to remove
the
everything.
everything. Then they brought out only the uterus. And when they checked the uterus at histology, I had adenomyosis. The doctor was now like, yes, you see, it's adenomyosis. So we've taken out the uterus, so you'll be fine. I said, but I don't want to have this thing anymore. And you're too young. I understand the doctor's concern because if I had, if I was, how old then? I think I was 33 or 4. I was going to be in menopause, right?
Hmm.
And they're saying I'm too young to be in menopause. It's not good for my heart health, brain health, and bone health to start deteriorating faster. And I'll have to be on HRT for a long time, blah, blah, blah. And HRT too is dangerous to the, because it's a risk of breast cancer, blah, blah, blah. That I won't be able to manage the menopause. I said, as I am like this, am I living? Am I living a normal
Hmm.
life? I can't do anything. I don't want this period anymore. I understand your concern, but I'm telling you what I want. So
Hmm.
they left it. They said, okay, it's the adenomyosis. I said, okay, let us see how it goes. I started having my period again. Everything was, was 4 months after the pain was back. Oh, I mentioned that the frozen pelvis was back at that
Hmm.
second surgery. When they detached all my organs, they cut into my bladder and gave me a fistula. I was leaking urine from my bladder to the vagina. I was in a urine bag for 6 months. I was carrying a urine bag on my leg for 6 months. So you see, this is one of the things that this endometriosis, it just affects this organ, affects
It's
that
a whole
organ, disrupts.
disruption.
Yes. My intestine, the thing is for my intestine, I have adhesions on my intestine. They can't detach everything because they said there's a risk of cutting into the intestine and causing
Yeah,
a leak.
right.
Some people's case is so bad that they have to actually cut it and they will be on stomach bags for the rest of their lives.
Wow.
So these are the kind of things that this endometriosis does to people's lives. It's just damages an
Whew,
organ from one organ to the other.
to the other, which is
Yes.
truly, truly, truly worth the awareness. And
Yes.
please, I think you should just take time, anyone watching or listening, and sorry, who says this? Oh yeah, we had to change the timing. We're so sorry about that. Something came up and we just had to move the timing up a bit. So I think some people were joining at 9 p.m. mark. And
Nine.
so they're like, oh, we're
Yeah.
supposed to be here. We're supposed to just start. We apologize for that. Something came up and we had to just move the time a little before. But do not worry. You can always go back and watch the replay.
Watch.
Because
Yeah.
honestly, Jennifer has shared a whole lot tonight. And it's it's heavy for me. I just cannot imagine what your journey has been
Mm.
like, what you've been through. And honestly, I really want to doff my heart for you. I mean, I understand as a person of faith that I can see God's hands in all of this, but honestly, you are also a
Mm.
fighter, because this is especially with the way you explain the endometriosis, how it can show up in any part of your body, right?
Mhm.
It means it's almost like cancer,
Yeah.
because it's like
Yeah.
it can just pop up
Do you
here.
do you know that the pain endometriosis patients experience has been
Experience
classified as one of the top is it what do they call it, the pain when they're talking about the level of pain? They say
the
even those like
intensity.
the
Hmm.
intensity, like even cancer patients, the kind of pain that they go through, endometriosis is one of the top, I think the top three. The pain
Wow,
can be so like let me just
excruciating.
describe
Oof.
the pain. Whenever I have the endometriosis pain, I would scream like before. My husband till now says that my voice is not the way it used to be before. My singing voice, even my voice now is so deep. This wasn't how my voice was before. When endometriosis started dealing with me, I was on heavy painkillers like morphine, tramadol, and yet the pain will be back. It's just to mask the pain. The pain will be
Hmm.
back. Most times after taking tramadol, I would still have to be in the hospital to take one injection IV. I will
Injection.
make you
Pass
pass out.
out.
As in, you have to pass out. You can't just take ibuprofen and no, it will make you pass out. So instead, all those painkillers started affecting my voice.
Affecting. Hmm.
Yeah, my throat was always dry. So like that's one of the side effects of this painkillers. Dry throat. I was bringing out mucus all the time from my throat. So it affected my singing voice. My voice became deeper. I couldn't sing the soprano I used to sing before.
Hmm.
And I would scream like when I'm in pain. I used to scream to the highest pitch. And I would scream until I'm giving painkiller. And then I pass out. Imagine my husband having to drive me from home for like maybe a 30 minutes journey. I
And
was
you're
screaming.
consistently screaming. Oh my God. Oh my God.
The thing is so that's why when I say I don't pray for my enemy, it's because
You
it is
understand?
very, very crazy. The pain is
My
crazy.
question is there a prevention for this, or is this something that is there a prevention, and is it hereditary? Because now you have two girls. How are you dealing with that fear?
So,
Of saying, "Oh my God, I don't want my daughters to experience this."
so the thing is, number one, they were saying it's hereditary one time, but I'm seeing other reports that says it's not hereditary and it can happen to absolutely anybody. And there is actually really no like preventive measure to be taken because the cause is not known yet. They are still trying to do research. That's why they're making noise, trying to
Oh,
push
the
them to
cause is
keep
not known
researching.
yet. Hmm.
So if the cause is known, we can know how to prevent it, right?
Right,
But the
right,
cause is
right.
not known. But what I know for a fact is that when all these things happened to me, I was reading here and there, finding out that your food can actually help you to manage the
Manage,
symptoms,
okay. Okay.
to manage the symptoms. So, but you see, when we're talking about this healthy eating, okay, they say if you eat this, it's increasing inflammation in the body, and endometriosis is an inflammatory disease. So you're supposed to be
Right.
trying to avoid foods that increases inflammation in your body, right? But
Mm.
you see, when you are in crazy pain, that's not what you are looking for. Can you relax and try to be taking, okay, I'm drinking this juice, so maybe by next month my pain will subside. I'm like, no, you
Right.
cannot wait to see the effect of the healthy eating. It works,
Mm.
but you cannot bear the pain while you're waiting for this healthy eating habits or whatever to work. So for me, I had the hysterectomy done. I eventually had the total hysterectomy done. They took out everything, the ovaries, the fallopian tubes, everything. They took everything out. And I wouldn't lie. Like if there is, I also say it in my post that hysterectomy is not a cure. It's only a way to
Mm.
manage. It's only a way to manage
Right.
because I still have the endometriosis. If you take out your uterus, look at everything, and the endometriosis is in the chest, in the lungs. Have you taken care of the endometriosis? No.
Wow. So where exactly then are you still experiencing it now? If your reproductive,
So the thing
organs
is,
have been moved, then how do you
so
know
the,
you still have it?
because it's on the intestines. The
Ah,
endometriosis is on the intestines, causing adhesions on the intestines. Last month, I was in the hospital. I couldn't, like, I had the obstruction last year. I had the obstruction. I was thinking, like, it was mad. The pain was crazy. I was in the hospital. They had to do the
the
enema
cleaning
for
of the
me.
intestine again.
Yeah.
Wow.
So I was on liquid diet for a while so that I don't have any. So that's why I watch what I eat because I do not want to risk having an obstruction. So I watch what I
Mm.
eat. I try to eat foods high in fiber and all of that. I do not eat any. I'm a vegetarian, but once in a while I take fish. I take chicken once
Mm.
in a while. But beef is a no-no.
They
But
no no.
sometimes I take yeah, sometimes I take fish, sometimes I take chicken when it's been a while since I've had it. And then
Mm.
times I've noticed firsthand that whenever I eat um foods that like if I take ice cream, if I eat fried foods, if I'm just careless with my eating, maybe after 2 weeks I will be in pain. So
Mm.
I've been able to I know already that there are some certain
Been able to
foods that
study.
increases.
Mm.
Yes. So I monitor what I eat. So I even used to write it down. I have like a food diary where I write what I
Mm.
eat and all of that. So I'm able to track it later on and say, oh, okay, I ate this thing 2 weeks ago and I had pain um like 2 3 weeks after. So I'll say, okay, let me stay away from this. So before I stopped eating animal produce, I was eliminating it one by one. So
Mm.
I would eliminate beef first and I'll still eating chicken and fish. See what happens. And then later I
Mm.
eliminated beef and chicken. Then I eliminated all
To
three.
know
I was
how your body is reacting
yes,
to them.
yes. And I found that it really helps. And when I stopped sugar entirely, like when I stopped sugar, I saw a huge difference. And that's why I'm always saying that okay, if you are having any reproductive health issues, please,
Mm.
there's so many other things you can use as sweetener apart from sugar. There's so many other things. There's
Mm.
agave syrup. There is even stevia. They're saying stevia is not good. Stevia is not good. You can still use stevia. At least just
Honey.
moderation. Yeah, honey, apply dates. You can just apply moderation and everything. But sugar itself, don't say you are applying moderation with sugar. Don't even just. But if you
Just take it
can,
out.
if you don't mind experiencing like me now, sometimes I would say to myself, let me take the sugar. I know when the pain comes, I'll take painkiller.
I will take it.
You understand? So then I'll have the ice cream, and then I know that when the pain comes, I'll take painkiller because now the pain is not as bad as it used to be anymore. Why?
Mm.
Because number one, I do not have my menstruation anymore. And
Right.
I'm sure that if I was still having my menstruation, I'm sure it could have been way worse. So the
By
fact that I'm
now.
not the fact that I'm not having my menstruation at all is also giving me, I think that's it means that management method, is to take
Route,
out
right.
everything. Yes,
But then when
but
you
it's
take out
not a
everything, like
cure.
you mentioned, but like you mentioned earlier, that when you take out everything, it's almost like it brings menopause faster, right?
My
How
my
is that?
menopause, it's a
How is that
different ball
playing
game.
in this? Oh my god.
It's a different ball game entirely. I'm telling you. My
My
menopause
god.
came, menopause comes in stages, right? Menopause doesn't
Oh,
just attack.
Father. Women
Menopause comes from like maybe 10 years before menopause. You would have been having perimenopause,
free.
right?
Okay.
Your body, you will be doing like, okay, menopause is coming, your body is being prepared. Like even you too, you are taking some vitamins, supplements, you're preparing yourself for menopause. But I didn't have that chance. Mine just came boom. And so the moment it came like that, my bones started deteriorating immediately. So I had to go do a bone density scan. It was quite low. And then they had to quickly start, pumping calcium and vitamin D for me. And it's got better. But even till now, like, and then the menopause symptoms, oh my goodness, crazy. I was placed on hormonal replacement therapy. And I realized that that drug was making the endometriosis flare up more. So I had to stop the HRT. And then I wasn't on any HRT for like 3 years,
Hmm.
and it was affecting me. Because number one,
Wow.
if you do not, you know that for women, our hormones is what keeps us woman, is what
Women.
keeps us
Hmm.
existing. Like now, our hormones, estrogen is responsible for our brain health, responsible for our bone health and heart health. So if you do not have estrogen at all, that's why when you get to menopause, you start aging faster, right? You
Hmm.
start, yeah. So that's the reason why even women that enter menopause, they will not even still say, okay, oh, I'm now in the menopause stage, so let me embrace menopause. They will still be taking HRT so that they can still enjoy their lives a little bit more before they get to that gray age. You understand?
Hmm.
So me not being on any HRT wasn't good for me at all. Until I met with like being in the UAE, I didn't have insurance, and then I didn't have my Emirates ID for some time. I was still trying to get my Emirates ID, so I couldn't go to the hospital to have a proper checkup.
Right.
So yeah, so it was until just recently, wasn't it last week, that I was able to consult with Dr. Ulama at King's College Hospital in Dubai, and she
Hmm.
was able to you know prescribe the HRT I'm supposed to be on. And
Right.
I'm looking forward to a better life with this menopause, because I've just been dealing with it just with supplements. But definitely, she told me, she said, quality my life. I was reducing my life expectancy wi- whilst staying away from HRT, because those that get into menopause like that, surgical menopause, before the right age, you you die faster, basically.
Hmm.
Yes. So because you're
Because
not
you will
supposed
age
to be,
quicker
you age quicker, everything will just start dropping, because it's supposed to be a gradual thing, and yours just came suddenly, even at a young
suddenly.
age. Yeah. So she says, no, you have to start this fast, fast, fast. And then I'm on all the HRTs now that she has prescribed. I've started taking them, and I'm already seeing changes. Yes, I'm seeing changes in my body already. And yeah, I'm looking forward to a more productive life now with the menopause. And I would say, even those in menopause right now, I would say that don't menopause is another thing that needs awareness, actually.
Right.
I
Right.
Yes, I attended a menopause event last month, and I was the youngest there. All the other women were, in the
Older
menopause age,
women.
or perimenopause age, and they welcomed me to the community. I told them about my story and all of that, and then they were saying it's true that yes, major look at them, they are 50s and all of that, and they are strong and healthy. They are exercising.
Hmm.
We keep talking about this thing, like we need to. There's a lot that comes with it. There are some people
Hmm.
that have some health challenges, and because they have menopause, they are in menopause, doctors are also dismissing their symptoms, saying, "Oh, just menopause."
Right.
Meanwhile,
Mm.
meanwhile, they are
There
dealing
are
with
other
something
underlining
else.
factors.
Yeah.
Mm.
And then you are dismissed and you're saying, "Oh, it's menopause. Just that's how menopause is. And there's also something else too. Some people that have some health challenges, menopause is not allowing them to take the proper medication.
Right.
So
Mm.
so there's so many things
Whew.
involved.
Honestly,
We're being
we
we're
could
being
talk.
told as women, I'm telling you, there's a whole lot. There's a whole lot.
There's a
There's
whole
a whole
lot.
lot.
There's a whole
So
lot.
the
So,
advice I just want to give women is
yeah.
your health is very much important. Do not take yourself as don't see yourself as a machine and like a superwoman. Like, oh, I'm so strong, I can do anything. And there was something that I had a live with the dietitian last Saturday, and she said something that so many people do not know that. Some people say, I can eat anything and it doesn't affect me, right? You are not going to see
Mm.
the effects right now. Some people will be fine for the next 10 years before you start to see the effect of your bad choices right now. So
No.
majority of people get carried away with the fact that you are strong and healthy right now, right? I'm sorry, let me
Mm.
quickly, I think my battery is low. You're strong and healthy right now, and then you take it for granted and you live anyhow. Your lifestyle, you make poor lifestyle choices. You do not exercise. You need to exercise. If you're over 30, do not joke with your health.
Mm.
Exercise. We have so many people right now with you are taking your religion as something else. God Himself is the one that gave doctors knowledge. He is the one that made it possible for science to be what it is right now.
Mm.
He's the great physician, yes. And He made these doctors, He gave them the knowledge, He put it in them. So stop saying things like, "Oh, what I don't know will not kill me." Or you say things like, "Oh, I'm covered by the blood of Jesus." Or you say that, and that's the reason why you neglect your health. Do you go for an interview without preparing for an interview? Do you
Mm.
leave your doors open at night without locking it, saying the angels are
Mm.
watching over you? Especially in a country like Nigeria. Let me use UAE for example, because most of us will leave our doors open overnight.
You can leave your door open.
Let's say you are in America, you are in Nigeria, and then you leave your door open overnight. You don't do things like, so why do you take your health for granted? Okay, are you a smoker? Do you smoke? Are you do you take marijuana? If you don't take marijuana, why are you taking sugar like your life depends on it? The same effect is what this sugar is doing to you. When you are so
Mm.
addicted to sugar, it's the same thing as being addicted to marijuana or being addicted to cocaine. And the damage it's doing to your body is the same. So we
Mm.
need to stop living our lives like in passing, like whatever goes. Like you don't even plan yourself, you don't plan what you eat. And then yet you plan your outfits for the day. We pair the perfect earring with the perfect necklace and the rings and the makeup, the nails, we do everything, but we do not care about the inside. It's
Mm.
not done. Ladies, please, let's take our health seriously. I'm not trying to scare anybody, but darlings, it is the fact, it is the truth. What we
Right.
put inside our body is what comes
Yes, of
out.
course.
It
Mm.
affects us, guys. Please,
Mm.
let's try to make conscious efforts to eat healthy. I'm not saying you should eat only vegetables or become vegetarian. Apply moderation. You see people eating. I can't believe that till now people are eating 5 pieces of meat. Why? Why? Goodness.
Mm.
And it's not, and we've been, I think it's because we grew up with the fact that they say you must eat at least 2 pieces of meat in your, it's not compulsory to eat meat. There's so many other things you can eat. You won't die
Mm.
if you don't eat meat. You can eat meat. I'm not saying don't eat meat. Eat meat, but apply moderation in everything.
Moderation.
And do
Mm.
not say, somebody was telling me one day that I can't kill myself. Anything I eat, I will eat. Anything I can eat, I will eat. I'm too busy. I'm
Mm.
too
Or
this. I'm
die,
too
not
that.
die.
No. And if you're saying that, okay, I'm conscious of my eating habits, I'm careful. If you do not put it down, guys, you will forget. If you're not mindful, if you don't plan for it, you would continue to eat in passing. Plan your meals. It's not difficult. We plan what
Mm,
we would wear. We plan these things. Plan what you would eat. Your health is very much important. Just have it at the back of your mind that what you eat has a direct impact on your well-being.
oh
If
my
you're not
God.
seeing the effect right now, you will see the
He's
effect
waiting.
later.
Oh,
And if it doesn't affect you, funny enough, some people have this I don't know, they have strong genes, whatever, it doesn't affect them. Some people say, I know somebody now, till he was 60, he was 70, he lived well, he wasn't living he wasn't healthy, but he had a long life. Do you know what he has passed on to his children?
to the children. Mm,
It might not it might skip you and go to your kids. So you are very much important. So please, guys, let's be serious with whatever it is that we're doing with our health. Be serious. For me, what has worked for me so far is my mindfulness with my eating habits, and I try to exercise every day. It's not until you carry heavy weights. It's not until you
wait.
you run how many miles. Just take that conscious effort. I always say something. If you go up and down the stairs, even just 3 floors, if you do it for 15 minutes, jog up and down. 15 minutes, oh, it's okay. Every day,
Right.
it's
Mm,
okay. Just try. Please, your life depends on it, actually. So just try.
mm.
Drink water. Stop. Put away the soda.
Easy
Put it
drinks.
away. Drink water and juices. Juice your own juice. Don't go and buy all this one that they're selling outside. It is not pure juice. Buy fruits.
The
Blend
fruits
it.
and juice.
It's not until you have expensive juicers or whatever. Blend it. Even if it's not, blend it and drink it. Food is medicine. And let's treat it as such. Please, guys, our lives depend on it, please. It's very much
Wow. Thank
important. So let's
you.
take our health seriously, please. It's very
Thank
much
you so
important.
much.
I
Wow. I
get
mean, I
messages
could,
all the time. A lot of women are
I could,
dealing with so much.
with so much, I
Please.
can imagine. And
Yes.
I can
Yes.
really, really feel your passion. Like it's palpable. And I know with the story you shared with us tonight, I know it's coming from a place of pain. And knowing how
Mm.
excruciating that pain is and saying no. Nobody else should go through this kind of pain. It is like I will not sit here and allow anybody go through it. And I just want to say
Yeah.
thank you for lending your voice to this cause. Thank you because you are making a significant impact in the lives of everyone who listens to you. Because now it's that awareness, like you said, is actually creating an awareness and is helping us think again about how the choices we are making today, knowing that it might not the results or the outcome might not be glaring today, but a few years down the line, anything can happen. And so taking precautions now is very, very vital to us. Thank you for all of you who are joining on Instagram. I see you. You are hitting the nail. Agnes says, this is so much. Kes says, Chai, this one is an attack on my person. And I think it was around when you talked about the food, how we prepare for our bodies and are done everything, but we don't prepare for what we're putting inside of this body. And remember, you only have one body, there is no spare anywhere. So let's try, let's work, let's not try, let's just take care of the body so that we're able to, do everything that we actually want to do. Because without a healthy body, you can't fulfill
Yeah.
purpose, you can't fulfill your vision, you can't make an
Yeah.
impact, you can't make a difference, not to yourself, not to
Yeah.
the people you love or anyone
Around you.
around
Yeah.
you. Yeah, so please, 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 let's do this. So if I feel like there's a lot that you still want to share, but do you have like a platform where you share, where people can come and connect with you to hear more of what you have to say or follow with your journey, so that some way they're getting inspiration, from the
Yeah.
work that the way you're managing yourself now?
Okay, so I have my page on Instagram, Jennifer Oni on Instagram. I post whatever research I find helpful, I share it, and my day-to-day activities and how I manage with some endometriosis still. I share it on that page. I also have a WhatsApp group. It's called Mindful Maidens. I also have an Instagram page for that as well, where I just post like recipes and how to manage your hormones, your hormonal health. And I have a WhatsApp group where we are trying to live a mindful life.
Mm,
We share recipes, try to encourage everybody on a daily basis to make mindful decisions. So I have
Right.
that WhatsApp group as well. The link to the WhatsApp group is on my page,
Okay.
on my Jennifer Oni page, and also on the Mindful Mavens page on Instagram as well. So
Okay.
yes, yeah. And I want to say something. You asked me about how I manage, like knowing that I have girls, I have daughters, and how what I'm doing, because I know what I've been through. The thing is, my kids also got to experience my journey, you know, and I did keep it away from them. I made them to
Mm,
understand what I was going through when I was going through it, and I was always explaining it to them. So it wasn't as if I was trying to put fear in them, but I made them to
mm.
understand that lifestyle choices is very, very important. I know you saw the exercise workout we did on Saturday.
Yes.
My
Yes.
daughters were actually doing,
You're the
they
one.
were like,
Yeah. Leading,
the coach
leading
leading the
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 women.
workouts. So
Yes.
the thing is, my daughters have actually they wake up about 6:30 in the mornings. They actually exercise. They have a routine they are following. I didn't ask them to do it. I asked my daughter. I
Mm,
said, "Why are you exercising every morning?" What happened? She said, and she doesn't know. She thinks God is just telling her that she needs to take her health seriously. That she just noticed that she's been seeing some things lately, and it's like God is. She actually said, "It's like God is pushing me to take my health seriously and to be exercising more." I said, "Wow,
mm,
okay, carry on, please."
mm.
So and then the two of them, they do it every morning. They just not vigorous exercise. They do like aerobics, kind of
Right.
exercise every
Stretches
on
and yeah.
with stretches and all of that. And when in my house, if you put if somebody comes and maybe you go for a party and they bring Fanta or Coke or Pepsi, it will be in my fridge for 2 weeks. Nobody will drink it. My kids are already they already see it that okay, this thing is dangerous. My That's why when I started the journey of this endometriosis, ovarian cyst, and everything, I started educating my children from when they were about 6, 7 about menstruation and how it is, things that can happen and everything like that. When my kids started their period, it was not my daughter started at 11,
Mm,
and it was not anything, it wasn't a big deal to her. She knew what it was, she knew how to take care of herself, she knew what she should do, what she shouldn't do, the how to care the menstrual hygiene. That's even another
mm.
topic entirely. Because
Entirely
that
right.
day, I remember I was in the store buying a pad for myself. And I told my daughter to go and get another type from the type I used to buy. And she came back and said, like, "Oh, mommy, your period is coming this." I said, "Yes, I think it should come tomorrow." And this lady beside me was wearing it. And she said, "Why am I telling my daughter such?" And, I, and my daughter was like 6, 7 then. And I asked her, I said, "I don't understand. Shouldn't she know at her age?
She's a
She's a
girl.
girl. She should
Mm,
know." She
mm.
said, "I shouldn't be telling my daughter about that." I said, "No, you are wrong. You need to start informing them from at least age. Once they are smart enough, start telling
To
them about it."
capture it. Yeah.
Yes.
Mm,
So she got to know everything. And then the period came at 11. Everything was so, even now, she too started experiencing it. When she took ice cream the other day and then she started having serious menstrual cramps. And then she was like, "Ah, mom, it's true. What you've been saying is true." Because the day when I didn't took ice cream, I didn't have food. The day I took ice cream,
mm.
I had pain. So you see, I said, "Okay, can we see now?" It has a direct impact. What you eat has a direct impact. So that's the reason
Impact,
why
right.
even they too, they take it seriously. So we all need it. We say enjoyment. My kids need to, I'm taking them to enjoy. Yeah, taking them to suffer. I'm just trying to be blunt. Even I know that when I take ice creams, I will suffer. So let me
Mm.
just use the word suffer. So I'm not saying, okay, once in a while, okay, satisfy your cravings, okay, your body. Yes, but please apply moderation and teach your kids to make mindful decisions when it comes to
Decisions and
eating.
choices. Mm.
Yes, when it comes
Wow.
to eating. Don't say they're too
Wow.
small, let them eat anyhow now.
Any
Majority of
hour
us, majority of us now are suffering from the choices our parents made when we were younger.
made.
We
Mm.
were eating a lot of junk food, when we were growing up, which is
Mm.
one of the major reasons why a lot of us now are going through all this. Yes.
Right. Wow.
So we need to
Oof.
break
Thank
it. You need to
you.
break that cycle. Stop feeding
And
your kids
do what
junk
is
food.
needed. Hmm.
Yes, stop feeding your kids junk food. Let them get accustomed to eating healthy
Healthy.
so that
Hmm.
we break that cycle. Please, we're
Right.
always
Wow.
praying against generational curses, generational curses. Break the generational unhealthy eating habits. Let's
Or
break it.
patterns. Absolutely.
Yeah,
Wow. I mean, we could be here
break it.
all night long and you
I'm
still
telling
keep
you.
going because there's just a lot to unpack and there are different angles to it. Like in this one sitting, we've
Yes.
probably talked about five different angles we can even dig deeper into outside of, the topic for today. But thank you so much for putting your heart into this, for sharing your story, for not holding back, for not suffering in silence, because in you speaking up, a lot of other people are beginning to pay attention to themselves. A lot of people are beginning to recognize their own symptoms because, again, not everybody, like you said earlier on, the treatment for endometriosis is quite expensive. Not everybody will be able to afford it. So, you sharing your story and helping somebody articulate or identify what it is, and maybe then going through that and doing their own research to see what are the alternative treatments or management to this, they can at least do something for themselves if they can't even afford mainstream medicine, right? And so this is why what you're doing is important. And this is why I'm so glad that you said yes to coming to share your story and allowing us celebrate the impact that you are making in your own space with your story around these health issues. So thank you very much for being here. We really, really appreciate you. I'm sure Grace is sending here her goodbyes. She had to jump on another call, and that's why she's left the stream. But thank you, everyone who joined us. Please, please share this link with as many people as you can, whether it's on LinkedIn, whether it's on YouTube, whether it's on Instagram. This is going to be on our page on Instagram and Jennifer's page as well. So you can tag somebody in the comment section that you know should watch it. Let them watch it. This is pure information that can help. It's not just information, it's not just head knowledge. This is experience plus research, right? So it is rich in content. So please help us spread the word. You will be supporting the awareness. You'll be supporting the push of the awareness for this condition. But thank you so much. And guys, we really appreciate you. Another week done. We have 1.5 weeks to go. So 3 more sessions in March, speaking to amazing women who are making impact in their own ways. It doesn't have to be mainstream. It can be just this, sharing your own story and affecting the next person or impacting the next person with inspiration, with encouragement, with support, right? And that is what your voice, your impact is all about. So till we'll come your way again next week, Monday and Wednesday, and then the final Monday in March. This is the energetic EJ saying, God bless you. Remember, your health is very, very important. And that's why they say your health is your wealth. Take care of yourself. All right. God bless you. Have a beautiful night, everybody.
Bye, everybody.